Hi, this is Joy.
And Davidson, starring in Anatomy Joint Project.
Video.
Yeah. Okay, for the cartilaginous joints, there are two types, which are synchondrosis and symphysis. First one, synchondrosis. They're bands of hyaline cartilage. They unite the bones, and they're between the manubrium and the first rib, which are the costal cartilages. The second type, the symphysis, their function is a pad. They work as a pad of fibro cartilage between the bones, and they are located in the pubic symphysis and the joints between the bodies of the adjacent vertebrae.
Okay, there are three types of fibrous joints: the syndesmosis, suture, and gomphosis. The syndesmosis is a sheet of bundled fibrous tissue connecting the bones. It lies between the tibia and the fibula. The suture are between the fat bones. There are C-teeth-like projections, and the thin layer of connective tissue connects the bones, which is the skull. The gomphosis is a cone-shaped bony process in a socket. For example, the tooth and jawbone. The synovial joints are freely movable joints. There are three types of diarthrosis. The specific parts of diarthrosis are articular cartilage, joint cavity, joint capsule, synovial membrane, synovial fluid, meniscus, and bursae. The three types of synovial joints are uniaxial, the hinge joint, pivot or trochoid joint, the biaxial joint, the saddle or sellar joint, condylar or ellipsoidal joint, the multiaxial, which is the ball and socket joint, and gliding over plane joint.
Okay, there are many types of synovial joints. The first one is called the pivot joint, and they're between the atlas and the ends of the axis. The second one is the hinge joint, which is the elbow joint right here, and they're between the phalanges. The next joint is called the saddle joint, which is between the thumb and the carpals. The next joint is called the condylar joint, which is between the metacarpals and the phalanges, and this is between the radius and the carpals. The ball and socket joint is the next joint, and they're right here in the hip joint and right here, the shoulder joint. The next one is the gliding joint, which right here between the carpals and between the tarsals, which are right in the foot, and in the between facets of the adjacent vertebrae.
Movement at a joint occurs when the muscle contracts and its fibers pull its movable end towards its fixed end. The different types of joint movements. This is abduction, this is adduction, this is dorsiflexion, this is plantar flexion, this is hyperflexion, extension, flexion. This is circumduction, this is medial rotation, lateral rotation, supination, pronation. This is inversion, this is eversion, protraction, retraction, elevation, depression.
There are many synovial joints, and one of them is called the shoulder joint. It is a ball and socket movement, and it is between the head of the humerus and the glenoid cavity of the scapula. It has to do with the bursa, and it has a very wide range of movement, which is called circumduction. The next joint is called the elbow joint. And in the elbow joint, there's two joints inside it, which is called the hinge joint and the gliding joint. The hinge joint is between the trochlea of the humerus and the trochlea of the ulna, while the gliding joint is between the capitulum of the humerus and the head of the radius. The next joint is called the hip joint, right here, and it is also a ball and socket joint. And it also has freedom of movement, which is called circumduction, but it doesn't have as much as freedom as the shoulder joint. The last joint is called the knee joint right here, and it is the largest joint, and it is the most complex. And it is separated by the menisci, which separates the femur and the tibia from the knee.